Hi, I'm Audrey Herbert. In this section, we'll be discussing scanning techniques for the point-of-care cardiac ultrasound. For the parasternal long axis view, as you can see imaged here, we will be using the phased array probe. If you are using the handheld ultrasounds, both the Lumify or the butterfly probes will work to obtain the cardiac views. The parasternal long axis view is obtained in the 4th to 5th rib interspace, just adjacent to the left side of the sternum. Your indicator, depicted by the red dot, will be directed toward the patient's right shoulder. This places your sound waves in the long axis of the heart. As with all imaging, rest your hand in order to stabilize and make fine adjustments to your image. Occasionally, rib shadows or the left lung can obstruct your view in the parasternal long axis position. If you have the patient lay on their left side, this will bring the heart anterior in the chest and make your imaging easier in most patients. This is a still image of the view you're hoping to obtain in the parasternal position. Right now we are imaging through the middle of the long axis of the heart. Since we place the indicator towards the patient's right shoulder, the left side of this image will be towards the base of the heart, and the right side of the image is towards the apex. The top of the image is always where your probe is placed, in this case the anterior chest, and we're directing our sound waves posterior into the chest, which is viewed on the bottom of the image. Let's now go through the anatomic structures you can see in this view. First, let's go over the 3 chambers we can see in the parasternal long axis. First, starting with the left ventricle, labeled LV, you can see that this chamber is the largest and has the thickest muscular wall. The left atrium is viewed to the left of the left ventricle and is labeled LA. The most anterior chamber of the heart, therefore in this image the most superior chamber, is the right ventricle. We do not see the right atrium in the parasternal long axis image. There are 2 valves that we can see in this image. First, the aortic valve, labeled AO, can be seen between the right ventricle and the left atrium. Not viewed on this still image, you can also see a portion of the ascending aorta to the left of the aortic valve. Between the left atrium and left ventricle, you can see the 2 leaves of the mitral valve. The anterior leaflet is superior on the screen, and the posterior leaflet is deep on the screen. There are a few other anatomic structures we can also see in this view. First, between the right ventricle and the left ventricle, you can see the muscular intraventricular septum. Also, deep on the screen and posterior to the heart, there is an anechoic, or black, round structure that is a small portion of the descending aorta. If you now focus superior on this image, or anterior, bordering the right ventricle, you'll see a hyperechoic, or white line that outlines the heart. This is the pericardium. It can be seen both anterior and posterior in this image. Last, in this still image, you can see the posterior leaflet of the mitral valve connecting to the chorda tendineae and then to the papillary muscle. Let's now take a look at a clip in the parasternal long axis. As you watch the heart throughout the cardiac cycle, identify the 3 chambers and 2 valves shown in the previous image. Watch the movement and thickening of the left ventricular walls during systole. On this image, blood travels from the left to right, from the left atrium through the mitral valve into the left ventricle, and then from right to left as the left ventricle squeezes the blood and it exits through the aortic valve. Again, notice the hyperechoic pericardium surrounding the heart, both anteriorly and posteriorly. Last, visualize the anechoic descending aorta posterior to the cardiac structure. Here's another example of a parasternal long axis view. Try to identify all of the anatomical structures previously discussed. Let's now move on to the subxiphoid view. As you can see from the image, the probe is placed in the subxiphoid position with the indicator, again depicted with the red dot, positioned towards the patient's right side. To obtain this view, place your hand on top of the probe in order to allow downward pressure into the subxiphoid space. Again, rest your fingers against the patient's abdomen to stabilize your hand and make fine adjustments. To obtain this view, we need to direct the sound waves underneath the xiphoid process and into the chest. Start by fanning upward towards the patient's head. You will also likely to have to make a slight adjustment aiming your sound waves towards the patient's left shoulder. Occasionally, this image will be difficult to obtain due to patient's body habitus and protuberant abdomen. Having the patient take a deep inspiration and hold it may assist in bringing the heart closer to the probe and making the subxiphoid image easier to obtain. This is the image we are hoping to obtain in the subxiphoid position. In the subxiphoid view, we get a 4-chamber view of the heart and are also able to visualize the tricuspid valve and the mitral valve. As the probe indicator was positioned towards the patient's right, the left side of the screen is the patient's right and the right side of the screen is the patient's left. Again, the top of the screen is where our probe is placed, and the bottom of the screen is where we are sending the sound waves or pointing the probe. In the subxiphoid view, we're looking up from underneath the heart. You can see on the top of this image is a gray organ with vascular structures running through it. This is the liver. We're using the liver as an echogenic window to obtain this view of the heart. Occasionally, moving your probe towards the patient's right will assist in obtaining your image, as you can use the liver as a window for your sound waves. You can again see that the large muscular left ventricle on the right side here. You can also see the mitral valve and the left atrium inferior to the left ventricle on this image. The right-sided chambers and the tricuspid valve can be seen on the left side of the cardiac image, which is towards the patient's right. Watch the movement of the heart and the valves throughout the cardiac cycle. Again, notice the white pericardium surrounding the heart. Here's another example of the subxiphoid view. Identify all 4 chambers and the tricuspid and mitral valves. Trace the pericardium. Not visualized on the previous image, if you focus posterior or deep on this image to the cardiac structure, you will see an anechoic or black circle. This is the descending aorta.